We all know that COVID-19 has been with us for the past 2 years, and that mass vaccination campaigns to prevent further spread and infection are now occurring worldwide, and specifically in many countries. Although several preliminary results of the effectiveness of the different COVID-19 vaccines have been published across different populations, however, we know that evidences in terms of vaccine effectiveness estimates have focused mainly on US data or other country data with regard to the mRNA vaccines like the Pfizer or the Moderna, as well as the AstraZeneca and J&J. In other words, data on vaccine effectiveness in the prevention of COVID-19 for vaccines like the inactivated virus Sinovac are lacking. And this is what we're going to discuss today because finally, we have data to support that indeed Sinovac as an inactivated virus vaccine can help prevent COVID-19 infection. Let's watch this. So if you like my video, please click like, click subscribe, and a notification bell so that you'll be notified for any new uploads to come. So the data on vaccine effectiveness, specifically for Sinovac, have been lacking. We really don't have good data published in peer-reviewed journals to really support our claim that Sinovac as an inactivated virus COVID-19 vaccine do help patients against suffering from severe COVID-19 infection. We all know that amid the COVID-19 surge worldwide, a total of 22 primarily low and middle income countries can only access the approved inactivated virus vaccine like Sinovac for emergency use. And that's mainly because most of the rich countries were getting the bulk of the mRNA vaccine. So like the Philippines, we only got in bulk the inactivated virus Sinovac. We really need a good real-world data, which are essential because they give us a glimpse of the real-world challenges, including logistics, cold chains, and vaccination schedules, which are some of the challenges other countries have to face, specifically in the Philippines. So the problem we had with Sinovac as a vaccine in our country is that despite its global importance, there was limited evidence available on the efficacy and effectiveness of the vaccine, making people really doubt the effectiveness of this vaccine in preventing severe illness of COVID-19. In fact, I would say it is ranked as the most maligned COVID-19 vaccine to the point that it becomes a political issue, especially in our country. So the good news for most of us who have been vaccinated with Sinovac is that here comes the new data from Chile, recently published in a very reputable peer-reviewed journal, the New England Journal of Medicine, just last September 2, 2021. This study, which is a large observational study, estimated the effectiveness of Sinovac in real-world setting, which becomes an essential complement to the most important randomized controlled trials. A national immunization registry then keeps track of the vaccination schedules, and as of May 2021, the Ministry of Health has administered around 13 to 14 million of the Coronavac vaccine. It showed that around 11 million participants were included in the study. Around 10 million were included in the final study population. And then they looked at how many of those patients were fully vaccinated, partially vaccinated, or how many of those patients were not vaccinated. So if you look at this figure, it shows the crude cumulative incidence of COVID-19 in the study cohort. Clearly, you can see that in terms of incidence of COVID-19, it has been shown that unvaccinated patients really have the highest risk of developing COVID-19 infection. If you will see, there's really a difference in the vaccine effectiveness among partially immunized persons in terms of prevention of COVID-19, the prevention of hospitalization, the prevention of admission to the ICU, and the prevention of COVID-19 related death. So looking at this summary of this large prospective national cohort study in Chile showing how effective if the person has received 2 doses of COVID-19 vaccine Sinovac, it shows that in the fully immunized group with 2 doses of Sinovac, the estimated adjusted vaccine effectiveness was around 65.9%, preventing COVID-19, 87.5% against hospitalization, 90.3% prevention of ICU admission, and 86.3% for the prevention of COVID-19 related death. These data therefore concluded that the study provided estimates of the effectiveness of the administration of this inactivated virus, Sinovac or Coronavac, in a countrywide mass vaccination campaign for the prevention of laboratory confirmed COVID-19 and related hospitalization, admission to ICU, and death. This therefore provides us some confidence that indeed, when we were inoculated with Sinovac vaccine, that we indeed have this protection coming from this inactivated virus vaccine. In fact, the vaccine effectiveness in this study were similar to the estimates that were initially reported in Brazil for the prevention of COVID-19 and Turkey, suggesting that Sinovac or Coronavac vaccine really had high effectiveness against severe disease, hospitalization, and death. And this is the main reason why we get the vaccination against COVID-19, to reduce our chances to be hospitalized, get ICU admission, and of course, COVID-19 related death. The findings therefore underscore the potential of this vaccine to save lives and substantially reduce the demands of the healthcare system. We have a data that we've been looking for, published in a reputable New England Journal of Medicine, showing that indeed Sinovac has an effectiveness almost similar to the other vaccines. The study also assures most of us who have received Sinovac as the vaccine preferred of choice. In other words, just like any other vaccine approved by the World Health Organization under the emergency use authorization, this vaccine, the Sinovac, is as protective as other vaccines against severe disease and illness. And now we have this real-world data from Chile to prove that this vaccine really works. Again, this is Dr. Jerry Tan. See you again soon.